spread of the coronavirus. Today's briefing comes as meat plants here in the Midwest shut down due to infections among employees. The latest JBS Packerland, a beef processing plant in Green Bay, says it's closing temporarily after 189 COVID-19 infections were linked to the plant. Wisconsin Governor Tony Evers is addressing the media right now about the state's response to all this. Let's go live now to the Wisconsin State Capitol in Madison.
And allowed golf courses to open back up across the state. As I mentioned last week, the good news is that our Safer at Home order is less restrictive than many other Safer at Home orders still in effect across our country. You've likely heard me talk about reopening our economy, and I've said all along that it needs to be more like turning a dial than flipping a switch. No one wants to open our economy as much as I do, and we're working to do everything we can to make sure we can do so as soon as we safely and responsibly can. And that's why today we're announcing a new order that, coupled with our Safer at Home order that went into effect last week, turns the dial a notch by allowing non-essential businesses to do more than they were able to do before. Under our original Safer at Home order, non-essential businesses were only able to do things like process payroll and employee benefits or preserve inventory or equipment. So there are some big changes in that order that went into effect last week and the order we announced today. So I want to spend a bit of time just talking about what our new Safer at Home order means for families and small businesses across our state. That means every business across our state can do things like deliveries, mailings, curbside pickup, and curbside drop-off. So for example, whether you're an upholsterer, a taxidermist, a dog groomer, or you rent recreational equipment like kayaks, paddle boats, or canoes, you'll be able to provide some of those services under our new order. Now, we still need folks to do this safely. So if you're in a business who wants to start doing deliveries, mailings, curbside pickup, or drop-off, we still need you to help us make sure that our workers and folks across our state can stay safe while supporting our local businesses. That means we still want those operations to be able to be performed by one staff person in a confined space. Services must be paid for online or by phone, and customers can't be inside the business or facility. This is an important step in making sure that while folks are staying safer at home, they can also continue to support small businesses across our state. If you have additional questions on how to make sure you're taking the necessary steps to keep your workers, business, and customers safe, please visit WEDC.org. While we're turning the dial a notch on what some of our businesses can do, we're not out of the clear just yet on Safer at Home. Secretary Palm will give an update on today's COVID-19 cases in Wisconsin in just a few minutes. But over the past few days, we've seen some concerning numbers, including the largest single-day increase in positive cases since the COVID-19 outbreak started. In particular, and I know some folks asked about this last week, we are working hard to address the increases in Brown County. Our folks have been working around the clock to address the rise in cases in Brown County, and I've spoken to County Executive Troy Streckenbach to offer state support to bolster their testing and contact tracing efforts in the area. But what we're seeing in Brown County and others in our state underscores the importance of taking a statewide approach to Safer at Home right now. I know folks have asked about reopening rural communities sooner and taking a more piecemeal approach, and I hear those concerns. Here's the deal though, an outbreak in a rural area where access to health care is already limited and healthcare resources are scarce could have the potential to severely overwhelm local governments and local healthcare workers. We don't want that to happen. That's why we continue to monitor the data and why, for now, we are continuing to ask everybody to stay safer at home. Working to flatten the curve is critically important. It's also why we're taking a phased approach with our Badger Bounce Back Plan, which provides benchmarks for our state so that we have a better idea who's sick and who's not, where the disease is progressing and where it's abating, and what medical resources are available in each community. It's a data-driven approach to keeping people safe. There have been a lot of questions about setting a date for when more businesses will reopen. Again, the good news is that, especially compared to some of our neighboring states, Wisconsin has a significant number of businesses that have reopened and many more that never closed in the first place. There are tens of thousands of people working every day around the state. We know that people continue to do essential activities like grocery shopping and picking up medicine. We've opened up activities like golf, expanded curbside pickup for many retailers, and continue to evaluate ways that businesses can operate safely. I've had many discussions with business owners and business leaders across the state, as well as many working folks, and we will keep those conversations going as we continue to turn the dial. We have to be patient, and I know that this is tough on workers and businesses and consumers alike. Everyone depends on a thriving economy. But I have faith in Wisconsinites, and I know we will get there if we continue to flatten the curve and we continue to develop testing, contact tracing, and PPE components that we need. We will start on the road back. And now I'll hand it over to Secretary-Designee Andrea Palm.
Good afternoon, everyone, and thanks for joining us again today. Last Friday, we launched a new data dashboard on the DHS Badger Bounce Back website as part of our commitment to transparency during this pandemic. While we work to turn the dial and phase our state open, we know we are asking you all to make significant sacrifices. We have an obligation to share our decision-making process with you, and that means sharing not only our criteria for a phased reopening of the state and our plan to get there, but it also means sharing our progress on those criteria and that plan. We want you to know where we're going, how we're going to get there, and where we are in our progress along the way. The data dashboard currently focuses on the Wisconsin gating criteria, taken from federal guidelines on what a state needs to accomplish to reopen safely. The criteria include standards to meet concerning symptoms, cases, and hospital capacity. DHS and key stakeholders from our healthcare systems are developing the methods to measure hospital capacity. However, the symptoms and cases metrics are up on our website already. The gating criteria require a downward trajectory in symptoms of both influenza and COVID-19, as well as a downward trajectory in positive tests as a percentage of total tests. Graphs on the website detail this data more completely, but I can summarize it here for you today. Based on data tracking emergency room visits for flu and COVID-19 symptoms, we see a slight downward trend, but one that is not statistically significant. Our positive cases continue to rise. The data dashboard displays this information as a percentage of positive cases out of the total number of tests, which currently is showing an upward trajectory. This is a good time to share our daily numbers with you more broadly, as we do every day. We have 48 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of almost 11,000 tests. We have 61,311 negative tests, which is an increase of 2,076 over yesterday. There are now 6,081 confirmed cases of COVID-19 in Wisconsin, an increase of 170 over the total yesterday. Our deaths have now reached 281, and we have one county reporting a death for the first time. That's Manitowoc County. These numbers are why we need to commit to Badger Bounce Back, because Badger Bounce Back will make it possible to achieve the Wisconsin gating criteria. Rapidly and dramatically increasing our testing capacity and recruiting enough contact tracers to follow up on positive tests will give us the tools we need to contain this virus. Testing will show us the spread of the virus, and tracing will enable us to help individuals who test positive for COVID-19 to quarantine and to stop continued spread. We are aiming for 12,000 tests a day, or 85,000 tests a week, and to hire 1,000 contact tracers. Just like our commitment to reporting our progress toward meeting the gating criteria, we will also report on the progress we make toward these goals. And that is because we can't bounce back on our own. Badger Bounce Back is a community effort, and that is why we want you to have this information on our progress, because it's your progress too. And as we make progress together, we will continue to turn the dial. Thank you for your continued partnership in this effort.
And thank you. We'll now open it for questions. A reminder to maintain audio quality, to keep your phones on mute until it's time to ask your question. And in the interest of time, please, one question per reporter per media outlet. And we'll begin today with Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking my question. I do have to ask it in two parts. What kind of instructions has DHS given to local jurisdictions about assessing the deaths of people who have not been tested when they were alive, and what are those instructions? And the second part is, what is the current thinking about what % of the population not tested might be infected, and are there plans to further expand testing to identify non-symptomatic cases? Thank you.
Yeah, this is Ryan Westergaard. I can take those questions. The first one is about reporting and understanding deaths from COVID-19 of people who weren't tested while they were ill. And early in the response, we worked with CDC and developed guidance for medical examiners and through mortuary affairs to identify best practices for testing of people who have died. And those guidance documents have been disseminated, and there's clear mechanisms for being able to do that, and some infection control guidance as well. So that is something that can happen, and those are decisions that are made at the local level. Regarding the understanding the epidemic in the absence of comprehensive testing, there's a few strategies that we're trying to do to understand the true number of infections. One, as the Secretary and the Governor alluded to, is just to increase the testing as much as possible in healthcare settings, and that includes lowering the threshold for testing people who develop symptoms and having a greater coverage of people who are symptomatic in healthcare settings. We've also started to test asymptomatic people as part of specific outbreak investigations. So when we identify one or more cases in a high priority area like a skilled nursing facility, a nursing home, a jail, or other environment where people are in close quarters, we'll increasingly do a testing strategy that involves a sort of a blanket approach to testing a large number of people. And the third thing that we're working on in the future is using different kinds of tests, including antibody tests on a population level as a surveillance activity to understand the number of people who've been infected and not previously reported to care and tested in healthcare settings. A number of states have done that. New York State recently published a paper using a similar strategy, and we're looking into being able to do that in Wisconsin.
Thank you, Eric. Now to Mark Leland from WLUK in Green Bay. Mark?
Yeah, thank you very much. I wanted to focus on Brown County. Obviously, you indicate it's one of the hot spots in the state. What exactly is the state doing to assist in Brown County? And specifically also, you're talking about conducting more tests. You'd like to see 12,000 tests a day. Are you increasing the testing up here to kind of trace where it is spreading up here and what it is happening in Brown County?
So I can, Mark, I can dig into some of the specifics around that, certainly. We have been in close contact with Brown County over the past week or so. And initially, we surged 2,200 test kits into the county in partnership with Bellin Health and some of the workplaces there to do specifically testing of the workforce on site at those facilities. Over the past several days, over this weekend particularly, we have been in development in partnership with the county emergency management, county public health, the health systems in the region, local electeds. The governor mentioned talking to the county executive there over the weekend to develop a plan that will not only continue to test workers at these facilities, but will expand to include household and family members, as well as a strategy to test in the community more broadly. That work starts today. We have surged an additional 2,500 tests into the county to get that work started, and National Guard will be standing up a number of testing site teams to surge into the county to wrap around the work that is already going there, again, to make sure we are continuing to test workers, expanding to family and household members, and then to the community more broadly. So that is scaling up today over the next several days, and we are on track to continue in addition to the first 2,200 tests, the 2,500 additional tests to surge tests on a weekly basis into that outbreak until we get our arms fully wrapped around it. We've also surged contact tracing resources. As you know, we have been developing and building up that workforce over the last month, and as part of our goal to get to 1,000 contact tracers, Brown County has requested our assistance with contact tracing, which we have done. Specifically, they have referred 196 positive cases to our surge contact tracing team to do the follow-up on. So we have wanted to be and have been able to be helpful in the contact tracing piece of this as well.
Thank you, Mark. Now to Scott Bauer from Associated Press. Scott?
Hi, thanks again for doing the call. Governor, can you explain why this turning of the dial, as you say, is happening today, given that we're not seeing the trajectory yet in the right direction on these cases? What has changed to warrant this loosening at this point?
Well, as I've said all along, we keep an eye on the data and the science involved, and we believe that these activities that we talked about are kind of one-off issues where it's a single person, a single consumer interacting with a single provider of services. Say it's somebody that's renting a kayak. And it seems that we are able to do this in a way that's safe, and the things that we've laid out are very clear. That has to happen outside the business. It has, clearly the social distancing has to be there, and so there are enough control factors involved that we believe it's a safe expansion going forward.
Thank you, Scott. Now to Shemaine Mills from Wisconsin Public Radio. Shemaine?
Hi, this is Miranda Suarez filling in for Shemaine. I was wondering, going back to the Brown County outbreaks in the meatpacking plants, we received some questions for listeners who are wondering if it's safe to eat the meat that might have been processed or packaged in plants where there is an outbreak. So I'm wondering if you could talk to me a little bit about that, if it is safe to consume food from those places.
Ryan Westergaard here. I can explain the best that we know is that there hasn't been described cases of transmitted virus from eating contaminated food. It's never possible to prove something is impossible, but what we know about coronavirus and respiratory viruses in general is that they cause infection by coming in contact with respiratory cells in the nose, eyes, throat, and through inhaling. So ingesting contaminated food is not a common way for infection to cause in any respiratory virus, so it's not thought to be a great concern right now, but certainly it is always appropriate to proceed with caution.
Thank you, Miranda. Now to Victor from CBS 58 in Milwaukee. Victor? CBS 58?
Hi, good afternoon. Thank you again for taking the call. Can you hear me?
Yep.
Yep, okay. Just wanted to kind of bounce off of the Scott Bauer question about, the criteria for this specific order that was announced today. I guess, if you could kind of expand on if you see a timeline of what other activities or business operations do you see could be the next step?
Yeah.
Not necessarily a timeline of that, but I guess what could be, what are those, the next step you would see?
Yeah, and that's a good question. It's one that we've talked about, frankly, all along, is that as we have expansions, whether they're major or minor, and I'm guessing this fits into the latter category, we have an opportunity to observe that how it's working, have people report where it's not working, and we can maybe come up with some more frameworks to guide that financial interaction between a customer and a business owner, and also look at the data as it looks across the state. The previous question from AP was dealt with that issue. We've had some surges, absolutely, but if you look at it as compared to the number of tests, the trend line is up, but it's not like shooting out of the roof. It's marginally up, and so we'll continue to watch that. But we take these steps so that we can learn from them, so that the next opportunity that presents itself, we're doing it knowing how this worked. And that's why it's real important to reinforce that slow, methodical work around reopening the business world has to be methodical and slow, so that we can observe how it works and what we've learned from that to going forward.
Thank you, Victor. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell? The Wisconsin State Journal.
Yep, sorry about that. Thank you very much for the call today. I was just kind of bouncing a little bit off that, and I know that we don't want to, lock into a specific day as far as when we might get to that first phase of the Badger bounce back plan. But I was wondering if you might be able to talk just a little bit more on kind of, as testing increases, do we have any sort of an indication on kind of, when we may be seeing kind of that more widespread opening that a lot of people have been calling for?
Yeah, and I'll do it quickly, and Secretary Palm can add to it, or Dr. Westergaard. But we set criteria out there, and it's around those three things that are mentioned. And if the trend lines do head downward in a significant way, then that speeds up the process. If it's stable, that gives us some pause, but there may be some other opportunities we can look at. So it's also, it's following the data, following what's going on. We anticipate that with more testing and more especially more tracing going on, that we will get in that position so that we can make even larger decisions around larger changes. But we have to see that data going forward. And I just have to go back to a previous question. It's also real important for us today to talk about what good business practices are. We have a lot of essential businesses out there that right now that are serving the public, and we just wanted to remind them of the importance of social distancing in your stores. There are times when people drive by a large store and the parking lot is full, and that there's hundreds and hundreds of people within that store. The question should be asked, is there social distancing going on? So this also gives us an opportunity to remind those that have been essential businesses, especially in the retail world, prior to this or since the beginning of this pandemic, that we must insist that those social distancing, those good business practices are still going on. That is critically important for us.
I guess I would add on the testing capacity specifically, as we drive towards this goal of 85,000 tests a week, when you look at what that means on a per capita basis around the state, there is no place in the state that is reaching the kind of capacity that is necessary at the community level for us to feel like we've got enough data to understand the prevalence in those communities. And so our strategy around testing, in addition to what Dr. Westergaard talked earlier about, specific outbreak testing, working with our health system partners to stand up more access to testing through those settings. There also is a critical component of this that is making sure that outside of those traditional settings that there is access to testing for those who have symptoms, so that we are increasing the rates of testing across the state, commensurate with the goals we're setting around our testing capacity and access to tests more broadly. That is the way we're going to understand this disease. It is the way we are going to stop the spread, in conjunction with, as the governor said, the contact tracing, so that we are really containing it in a way that is aggressive, and that is the only tool we have until we have a vaccine or medical intervention. So we're tracking closely our capacity as it relates to its how it tracks across the population around the state, so that we are rising all boats, and that access to tests are increasing all over this state.
Thank you, Mitchell. Now to Casey Nelson from WTAQ Radio in Green Bay. Casey.
Hi, thanks for taking the call. And Governor Evers, in your opening statement, you mentioned dog groomers among the non-essential businesses that'll start being able to do some kind of services. And actually this morning in Oshkosh, a dog grooming business, the owner was taken into custody and is facing charges for not complying with the order. What's going to happen to people that are facing charges or are facing fines or warnings and things like that for not complying with the order, but are now able to? And I mean, it's a several-hour difference here between when she was told she's going to be facing charges and now that she could be doing these curbside services.
Sure. This is Ryan Elsistu, and I'd be happy to answer that question for the governor. So with all enforcement of whether it's the safer at home order or this turning the dial order, it's up to local officials to enforce it, and it'll be up to local officials in order to make a decision. When somebody is arrested or ticketed, then it's up to the local district attorney to exercise their prosecutorial discretion on whether or not to enforce that. And so it'll be up to the DA to decide on whether or not to move forward or take a look at the fact that, soon dog groomers across the state will be allowed to open, and they'll have to make that decision on it. But I do think it's one of the things that is worth pointing out with all this is, overwhelmingly we're seeing a lot of folks across the state that are in full compliance, and that's really what we're relying on, is people acting in good faith to be able to make the right and smart decision in order to protect both their health, their workers' health, and also their customers' health.
Thank you, Casey. Now to Amy Reed from WISC in Madison. Amy, sorry. WISC. Okay, we'll move on then.
Can you hear me?
Now we can, yes. Go ahead.
Sorry, I hit #6 instead of *6, so that won't work. So I'm looking at that data on the DHS side.
Well, that was the state of Wisconsin's daily briefing. Governor Tony Evers and his staff describing a few more things that businesses can now do in Wisconsin. Called it turning the dial, not flipping a switch. We'll have more on that tonight. The Minnesota Department of Health is now addressing the media at this moment. Let's listen into that.
27th. Governor Walz is not joining us for today's call. Today's agenda will start with an update on the COVID-19 outbreak from Minnesota Commissioner of Health, Jan Malcolm. Following that brief update, we'll focus on a topic that's gotten a lot of attention in recent days. That is the impacts of COVID-19 on our food processing sector and the efforts underway to help address those concerns. We'll be hearing brief updates on that topic from MDH Infectious Disease Director KRIS EHRESMANN, Minnesota Agriculture Commissioner Tom Peterson, and Minnesota Department of Labor and Industry Commissioner Nancy Leppink. Following that, we will open it up for reporter questions. So with that, I will now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. I'll do the quick data update as usual. globally, as of early this morning, the world was fast approaching 3 million total deaths. That was an increase of about 100,000 from the prior day, and just under 207,000, I'm sorry, it was just under 3 million cases and just under 207,000 deaths. The case total increased about 100,000 and the mortality by 10,000 globally. In the United States, this morning, the U.S. was just under 1 million cases, fast approaching 1 million, increase of about 60,000 over the day prior, and almost 55,000 deaths, an increase of 3,000 from the day prior. Here in Minnesota, today we are at a total of 3,816 total laboratory-confirmed cases, an increase of 215 from yesterday. This reflects a significant number of cases from southwest Minnesota, which we will be talking about later in the call. The new total of mortality, of deaths from COVID-19, is now 286, up 14 from Sunday's count, of Saturday data. 12 of these 14 deaths, again, occurred in residents of long-term care facilities, continuing that pattern that we've been seeing pretty consistently throughout the progression of the epidemic in Minnesota. This most recent set of 14 deaths includes 11 people in Hennepin County, 2 in Ramsey, and 1 in Winona. Demographically, this total includes 6 persons in their 90s, 1 in their 80s, 3 in their 70s, 3 in their 60s, and 1 individual in their 50s who was also a long-term care resident. As of today, 1,842 patients have been released from isolation. There are 292 patients currently in the hospital, 122 of those in intensive care. So we have seen a fairly slow but steady increase in the number of intensive care cases, but a lower percentage of the total hospitalization now in intensive care than we had seen a couple of weeks ago. With that, I'm going to pass it to KRIS EHRESMANN to kind of shift into a more focused discussion on food processing plants, which have been much in the news around the country as well as here in Minnesota. So I'll turn it over to you, KRIS.
Thank you, Commissioner. I just want to give you a little bit of an overview of the work that the department has been doing as it relates to processing plants. We began a proactive outreach to large meat processing and agribusiness facilities following the situation with the Smithfield processing plant in South Dakota, and provided some guidance to these facilities, talked through, considerations for distancing of employees, employee screening, just started a conversation with them about some of the things that they should be thinking about. And as you're aware, just over the last week and a half, we started to see situations evolving in Minnesota. In the case of JBS, we identified a cluster of cases who had the commonality of working at the plant, and we worked with local public health, with the local health care in the community to discuss the response to that situation. An MDH team visited the plant to evaluate their distancing for employees and provide guidance that they could consider for improving how they were doing things, including more aggressive employee screening and exclusion. Ultimately, given the number of cases identified from workers at this plant, an expansive testing for employees was stood up. This testing was conducted by the local Sanford Health. And this process, again, was a joint effort between the local health care, local public health, with some assistance from the Department of Health. Local public health has had a role in outreach, ensuring that essential services and housing can be provided, and helping to coordinate between the state public health as well as in health care. As you're aware, there are multiple such facilities across the state, and so MDH has stood up an active response for dealing with increase in cases of COVID from agricultural production plants. In many of the cases, local public health takes the lead in responding to reports of symptomatic employees from these sites. They will work in conjunction with their local healthcare system to ensure that, again, symptomatic employees can be tested. We at MDH serve as a resource to them, providing subject matter expertise and guidance as needed. And we help provide guidance for the employer on the importance of aggressive employee screening and other guidelines. The role that the Department of Health serves is providing guidelines and recommendations. We do not have a regulatory role for these plants. And in addition to that, we have also continued to do outreach. And so last week we did a call with vegetable canning plants to talk with them about some of the things that they should be considering as they anticipate ramping up their work as the summer season comes upon us. And with that, I will turn it over to Commissioner Peterson.
Thank you, Chris. And I'm going to emphasize a lot of what Chris just went through. I just say that, this is continues to be a very difficult situation for our farmers with these plants being down, and appreciate the partnership we have with Health and Department of Labor as we really try to keep our plants that are running and our plants that are down to be able to get them back in a timely manner. It's just incredibly important issue. I also want to, highlight too that we had a plant in Windham, Prime Court, that went down last week and is back up and running very well. I checked with them today, and so there's some good news in this too. And so as we continue to look at what we're doing as state agencies, is very important. Our Department of Agriculture, we've been working on building out our capacity at our smaller meat processing plants across the state to help, but and to be able to handle as more livestock as possible. But there just simply will be too many animals, hogs, and chickens to handle despite our efforts, and we will be needing to euthanize some animals. We're taking every step to not have that happen, but there will be that taking place. We'll be working with our American Veterinary Medical Association on the best practices for that as that moves forward. On the food supply issue, I just want to mention that for now our food supply is stable. Our consumers will see some disruptions as they have, and they may see some higher prices. It will become more pronounced if this, depending on how long we're in this situation with COVID-19. And so I'll be glad to answer any questions. And at this time, I'd like to turn it over to Commissioner Lechnick.
Good afternoon, everyone. Thank you, Commissioner Peterson. So I would similarly reiterate that the Department of Labor and Industry continues to work with the Department of Agriculture and the Department of Health to engage with the meatpacking and now also the food processing sector. Following on the engagement, the direct engagement we had at the beginning of last week with 50 of the meatpacking facilities, contacting them directly, and then communicating with them about the guidelines that the department had developed along with Department of Ag and Department of Health, and also seeking their assistance and understanding the health status of the workers in their workplace. Greatly appreciate the facilities that identified challenges that they were having, engaged with one or more of the departments to obtain assistance, and all three departments are ready, willing, and able to provide that assistance. In particular, the Department of Labor has an OSHA consultation unit, which provides basically free consultation assistance to employers. We have stood up a team that is prepared to answer calls over the phone, but also to provide immediate assistance, but also is able to schedule on-site consultations with employers who are having more significant challenges in identifying strategies for standing up processes and conditions that are consistent with CDC guidelines. So we continue to hope that employers will seek our agency's assistance so that we can assist them in navigating these challenges and won't need to find they won't need to find themselves in a situation where they would have to close down their plants in order to make the necessary changes. So again, the objective is to keep these businesses operating while fully understanding that there will be needed changes in how they operate their plants in order to address the requirements of CDC guidelines. So back to you, Michael.
Thank you, Commissioner Levick, and thank you to all our commissioners for those updates. We would like to open it up for questions from reporters now. To ensure that as many as possible have the chance to ask a question, we'll ask that when you do ask your question, please limit yourself to one main question and one on-topic follow-up. With that, operator, I think we're ready to take questions.
And you have been watching the Minnesota Department of Health's daily COVID-19 briefing. The governor did not speak today. Instead, his commissioners did update the public on many things, clearly turning their attention to the multiple meat processing and food processing plants that we have around Minnesota. They're turning their attention to it with expanded testing being launched, aggressive employee screening. The Ag Department, Tom Peterson, saying that because of those changes in the ag fields, the individual plants, that they will be needing to euthanize hogs and cattle as the closed plants are not allowing enough workers to process all those animals. An unfortunate piece of information there. We will continue to track the developments for you this afternoon and, of course, bring you updates as they happen on the WDIO website and mobile app. And we'll bring you the latest on WDIO News at 5.
This has been a WDIO News Special Report.